And welcome back, everybody. Glad you're watching Midday. January is National Cervical Cancer Awareness Month. And Dr. Carrie Gordon, she's an OBGYN with Mountain Star Healthcare, is joining us now. And let's jump into this topic. How common is cervical cancer?
Well, cervical cancer actually used to be the primary cause of cancer in women, but with the implementation of proper pap smear screening guidelines as well as the HPV vaccine, we've seen a significant decline in cancer diagnoses. In the United States, we still get over 13,000 women who are diagnosed with cervical cancer, and probably over 4,200 deaths per year, and that's just in the U.S. Other countries around the world have significantly higher numbers than that.
I know all cancer is serious, but is this a particularly serious cancer if you get that diagnosis?
Well, yeah, like you said, most cancers have a serious outcome or can have serious outcomes to them. Cervical cancer is a little bit unique in women's cancer because it generally affects the younger women. So we're seeing cancer diagnoses in their 20s and 30s. And if you can imagine the treatment that's related to that, hysterectomies, radiation, you can eliminate someone's ability to conceive and have children. It can cause chronic pain and problems, and it's really a severe, serious cancer in a younger population.
Dr. Gordon, are there symptoms that women should watch out for?
Well, most of the time, symptoms of cervical cancer will cause some kind of abnormal bleeding, but we can stop and prevent cervical cancer. It's probably one of the only cancers that we currently have tools for that can eliminate cancer altogether. And they are really utilizing pap smears and also initiating HPV vaccination at an early age.
So what age should you be getting that HPV vaccination?
Well, the target age is between 11 and 12 years old, and that's for boys and girls. But you can really start the vaccine as young as 9 years old, and really can go up to the age of mid-40s, 45 years old. I really usually suggest if you're over the age of 26, if you haven't had your HPV vaccine series, talk to your doctor about it. Find out, are you a candidate? Is it something that you should be doing?
And then as women, how often should you be screened? I know we put off get it going in, and you're like, I think I did that last year or the year before, but should it be every year?
Yeah, I mean, it's probably the first thing I see is a lot of women, they put their own health on hold, right? We take care of everybody else except ourselves. And it's so important because if you're not healthy, it's really hard to take care of someone else. But to answer your question, generally pap smears are about every 2 years after the age of 21. And every 3 years after the age of 30. But it really depends on risk factors as well as prior history of abnormal pap smears. You really should be seeing your physician at least once a year.
Yeah, ladies, this is right for your health, and this is serious. You need to take care of yourself. Maybe that's a resolution for the new year. Dr. Carrie Gordon is with Mountain Star Healthcare. If you have questions, they have answers for you. That's their website right there on your screen, and we can link you from ours at abc4.com/midday. Thank you for being here.
Thank you.
We'll be back.